It is a fascinating clinical moment. You've just received the genetic testing results for 2 of your patients, and surprisingly, both show mutations in the KRT14 gene at this locus. Despite the identical genetic hit, you want to see both patients again. You walk into the examination room to see your first patient, the young boy from clinical case 1. The first encounter, patient number 1. As you review his chart, you see the hallmark signs of a keratin-related ectodermal dysplasia. He sits on the exam table, visibly flushed because the clinic's air conditioning is struggling. You introduce yourself, and he smiles. You see something is wrong with his teeth. You ask him to open his mouth. Instead of the typical pearly white primary teeth of a 7-year-old, you see yellowish, severely malformed enamel with multiple dental caries. When you go to check his pulse, you notice his fingertips are completely smooth. He has Adermatoglyphia. He will never have a fingerprint. You observe a brownish, reticulate pattern of hyperpigmentation across his neck and axillae. His mother mentions that his older brother's skin cleared up in his 20s, meaning there is a family history of vanishing pigmentation, but the older brother's teeth were lost early. Observing all this, you write down the diagnosis. You move to the next room to see clinical case 2. The second encounter, patient number 2. She is a 34-year-old woman. On paper, her mutation is in the exact same gene, yet her presentation tells a different story. Her reticulate pigmentation is more widespread than the first patient's. She tells you, "It hasn't changed since I was young. If anything, it's more prominent now." You immediately notice diffuse thinning of her scalp hair and very sparse eyebrows, non-scarring alopecia. When she smiles, her teeth appear perfectly healthy and well-developed. She has had no history of enamel pitting or premature loss. You write down your diagnosis. I will give you a hint. Bad teeth and fading spots defines the first. Bad hair and staying spots defines the second. You are looking at 2 extremely rare genetic disorders that are very closely related. In fact, they are both caused by mutations in the same gene and are often considered different expressions of the same disease spectrum. However, they have traditionally been distinguished by clinical differences. The clinical flavor of the disease depends entirely on how the mutation affects the protein. The first patient's presentation points to the syndrome where the teeth suffer but the skin eventually clears. In the second patient, the persistence of skin markings into the adulthood, lack of dental involvement, identifies the condition where the skin suffers but teeth unaffected. I know, dear doctor, you're a clever clog and you already know the answers. So tell me, what is the diagnosis of patient 1, and what is the diagnosis of patient 2? The correct answers will be revealed once enough doctors have joined the discussion. Hope you enjoyed watching this case-based challenge. If you liked this video, don't forget to like, comment, share, and follow for more. Thanks for watching.